Hi, Assalamualaikum. I am Fatehah. In this presentation, I will share about developmental coordination disorder. So, let's get started. First of all, I will start with the definition. So, developmental coordination disorder or DCD is a neurodevelopmental disorder characterized by significant impairment in the development of motor coordination, which affects individual ability to perform everyday motor tasks. Children with developmental coordination disorder often have difficulty performing tasks that involve both fine and gross motor skill, such as forming letters when they write, throwing or catching balls, as well as buttoning buttons. Developmental coordination disorder is usually first recognized when a child fails to reach such normal developmental milestone. These are some of the examples of normal developmental. As for age 3 to 4 years, their fine motor skill include starts to walk backward and also side to side, climb stairs, and rides a tricycle. As for gross motor skill, it includes turns pages of a book, unbutton and buttons up clothing, as well as holds a crayon to write steadily. For age 4 to 5 years, their fine motor skill include hops on one foot, walks along a line, and runs on tiptoes. As for their gross motor skill, they can start to use a knife and fork and threads the beads onto thick string. For age 5 to 6 years, their fine motor skill includes start to jump, skips, and hops using both feet. For their gross motor skill, they can confidently use a knife and fork, steadily holds a pencil, and joins up writing. For age 6 to 7 years, they can ride a bike, jumps confidently, and runs with coordination, forwards and backwards for their fine motor skill. As for their gross motor skill, they can fully develop hand-eye coordination, draws complex shape, writes their full name, and writes a short story on the lines of paper. Lastly, for age 7 to 8 years, for their fine motor skill, they can hop on both legs and runs in a straight line. For their gross motor skill, they can cut using a pair of scissors. Children with DCD can lead to social or academic problems because of their underdeveloped coordination. They may have they may choose not to participate in activities on the playground. This avoidance can lead to conflicts with or rejection by their peers. Also, children who have problems forming letters when they write by hand or drawing pictures may become discouraged and give up academic or artistic pursuit. It is important for children who have developmental coordination disorder to receive individualized therapy because for many children, the secondary problems that result from extreme clumsiness can be very distressing. So experts recommend that a specialized course of treatment, possibly involving work with an occupational therapist, can be designed to improve the child's performance. As for example, special education setting can improve handwriting, keyboarding, as well as manipulation of materials. As for physical education classes, can improve general motor coordination with emphasis on skills the child can use in playing with peers can be very successful. Any kind of physical training that allows the child to safely practice motor skill and motor control may be helpful. For many people, developmental coordination disorder can last until adulthood. So, through specialized attention and teaching technique, many children develop the motor skill that they lack. So, that is all for me, and thank you for listening.